Comprehensive Periodontal Therapy. I am Shaju, Associate Professor, School of Dentistry. So these are the contents and we'll go directly to the first one, and which was the title. And what are the learning objectives? At the end of this lecture, the students should be able to explain the comprehensive treatment planning for the management of periodontal disease. Let's go to the first aspect, which is called as the scope of periodontal therapy. Why do we need periodontal therapy? It is to help retain the dentition in structure and function over their lifetime. And research has shown that this is possible with continuing periodontal care. Also, to have a good and reasonable plaque control. So periodontics is a specialty of dentistry that encompasses prevention, diagnosis and treatment of diseases of the supporting and surrounding tissues of teeth and dental implants. And what is the goal of periodontal therapy? Many times I would have asked you, what do you expect out of your treatment, especially when the discussion is on when to re-record the periodontal chart. The goal of any periodontal therapy is to preserve, improve and maintain the natural dentition, dental implants, periodontium, peri-implant tissues in order to achieve health, comfort, aesthetics and function. And when is the periodontium called healthy? When it is characterized by the absence of any inflammation, which may appear clinically as redness, swelling, suppuration, and bleeding on probing. Let's delve into periodontal evaluation. A comprehensive assessment of a patient's current health status, history of disease, and risk characteristics is essential to determine the periodontal diagnosis and prognosis of the dentition. At least, the evaluation should be carried out annually. These include examination of teeth, health of periodontal tissues including presence of any inflammation, probing depth, plaque and calculus, prosthetic restorative and any occlusal factors which can affect periodontium, any required radiographs for assessing the hard tissues including the bone level and its pattern, any systemic risk factors that affect the periodontal health, and its relation to periodontitis. Diagnosis, prognosis and treatment plan. The clinical findings, together with the diagnosis and prognosis, should be used to develop a logical plan of treatment to eliminate or alleviate the signs and symptoms of periodontal diseases, thereby arresting or slowing further disease progression. The treatment plan should be used to establish the methods and sequence of delivering appropriate periodontal treatment, which may include non-surgical, surgical, regenerative, and cosmetic periodontal therapy or dental implant placement. These also can include medical and dental consultation or referral for treatment, surgical and non-surgical periodontal therapy, adjunctive restorative prosthetic, orthodontic, and endodontic treatments or consultation, ongoing evaluation during the periodontal therapy, assessment and evaluation of risk factors including systemic and periodontal maintenance program. Informed consent and patient records, very important, right? Informed consent should be obtained prior to the commencement of any therapy. Complete records of the periodontal examination, including full charting, diagnosis, treatment, and recommended follow-up are essential and should be maintained always. The information provided to the patient includes all that is stated as well as others that ensures patient safety and autonomy. They include the diagnosis, etiology, proposed therapy, possible alternative treatments, and the prognosis with and without the proposed therapy or possible alternatives, recommendations for treatment to be performed by other dentists or physicians, reasonably foreseeable inherent risks and potential complications associated with the proposed therapy, and the need for periodontal maintenance treatment after active therapy due to the potential for disease recurrence. All should be discussed with the patient. Treatment procedures. It can start with the patient education, training in oral hygiene procedures and counseling on the control of risk factors, followed by management of any periodontal systemic interrelationships, removal of supra and subgingival bacterial plaque, biofilm and calculus by comprehensive, meticulous periodontal scaling and root planing, It can be followed by the chemotherapeutic agents, either local or systemic, which can be used to be as appropriate to reduce, eliminate, or change the quality of microbial pathogens or to alter the host response. Resective procedures, if needed, to reduce or eliminate periodontal pockets and create an acceptable gingival form that facilitates oral hygiene and periodontal maintenance. Soft tissue procedures in this can include gingivectomy, gingivoplasty, and various mucogingival flap procedures. Osseous procedures can include osteectomy, that is a bone removal surrounding the root, or osteoplasty or reshaping the bone. Periodontal regenerative procedures include bone replacement grafts, use of biological agents, root biomodification so that the root can lead to more regeneration, guided tissue regeneration, and or combination of these procedures for osseous, focation, and gingival recession defects and its management. Periodontal plastic surgery is done for gingival augmentation, correction of recession or soft tissue deformities, or enhancement of oral aesthetics. The others in this treatment procedures can include occlusal therapy, pre-prosthetic treatments, or extraction of teeth. The finishing procedures include the post-treatment evaluation of what has been done with review and reinforcement of daily oral hygiene. Evaluation of therapy. On completion of planned periodontal therapy, the record should document the following: that the patient has been counseled on why and how to perform an effective daily oral hygiene program, including managing their own risk factors. All the indicated and recorded therapeutic procedures have been performed and completed. The patient's response to the therapy has been evaluated, which is very important in periodontal therapy, as the patient response is mainly dependent on the host response, and hence the treatment objectives has been met. A recommendation has been made for the correction of any tooth form, tooth position, restoration, or prosthesis contributing to periodontal disease process. An appropriate professional periodontal maintenance program specific to individual circumstances has been recommended to the patient for long-term control of his or her condition. The periodontal maintenance therapy, and in this, which is the finale but which is ongoing, we have to update the medical and dental history, evaluation of current extra and intraoral periodontal and peri-implant soft tissues as well as dental hard tissues and referral when indicated, assessment of the oral hygiene status with re-instructions when indicated, mechanical tooth cleaning to disrupt, remove dental plaque, biofilm, stain, calculus. Local delivery of systemic chemotherapeutic agents may be used as adjunctive treatment for recurrent or refractory disease. Ongoing assessment of risk factors to identify an individual who may be more highly susceptible to ongoing breakdown of periodontal tissues, with elimination and mitigation of new or persistent risk and etiological factors. Identification and treatment of any new, recurrent, or refractory areas of periodontal and peri-implant pathosis. And finally, establishment of an appropriate interval for periodontal maintenance. And this will be what we have on the comprehensive periodontal therapy to be performed by patients who need them. Thank you very much.